This is Duke University.
What are the greatest challenges of this generation? For some people, it's climate change or rising income inequality. For others, it's about confronting terrorism or a rising superpower in the East. From my perspective, the greatest challenge for this generation of Americans will be fixing our education and healthcare system. Education and healthcare are two of the most important parts of the economy. I'm here in Durham Public Schools talking about education today. Education spending in the United States is actually a lot larger than you might think. We spend more on kindergarten through 12th grade than almost any other country on education. But in terms of results, we don't always do well. 25% of our students drop out of high school. 29 other nations beat us on a recent international math and science examination. That's disappointing because math and science are the foundation of the new economy, with jobs in science, technology, engineering, and mathematics. Worse yet, we used to lead the world in college completion, but now we're just middle of the pack. How can we spend so much and not get great results? Another part of the challenge is that the public sector, which has traditionally supported education, is stretched like never before. Take a look at our state budget in our home state of North Carolina. 77% of the budget in some form or fashion is on education and healthcare. When politicians are talking about tightening our belts or cutting spending, it'd be hard to do so without coming from these two areas. Well, if we can't spend money on education at the state level, where is it going to come from? The federal government's also stretched. 40% of federal spending is on healthcare or some other programs, and even a smaller part on education. If we don't raise taxes or cut spending, we'll continue to have deficits and a larger national debt. So if we're spending more and getting less, and if we're not going to be able to spend much money from government in the future, what's the answer to changing the equation in education in places like Durham and all around the country? That's something I've been thinking a lot about in my research. And for many, the answer is technology. Innovators and entrepreneurs all around the United States are trying to come up with ways to advance technology in the classroom. The idea is simple. It works like this. Think about the way we made cars in the early part of the 20th century. Lots of people and not too many machines. Go into an automotive assembly plant today, the kind that many of the students here want to work at. If you think about the way it looks now in the 21st century, there's lots of machines and far less people. General Motors, one of the biggest car companies of an earlier era, employed 600,000 workers at their peak and produced about 5 million cars. Today, they produce 9 million cars, but they only have 200,000 workers. It's that kind of technology for labor substitution that's changed many, many industries in the US and driven huge increases in productivity. It's the reason why you don't buy a plane ticket through a travel agent. You probably do it on a website. It's the reason you don't wait in line to see a bank teller. You probably use the ATM. But you know what? Education might not look like that. For all the innovators and entrepreneurs who are trying to disrupt education, we might be actually thinking about it in the wrong way. My perspective is we don't need to disrupt education. We need to figure out what makes great teachers work, and we need to give them tools that actually allow them to do their job better. It's a big difference in thinking. In one way, we think about substitute, take technology, and remove labor. That's how we bent the cost curve in many other industries. I don't think it's going to work like that in education. I think that people and technology are complements. We should be focused on putting the right technology in good hands. That's how we're going to change the equation in education. Let me give you a few examples. One of the things I've been working on in my research is a project called EduStar. It started off when I was a senior economist at the White House Council of Economic Advisors. My co-author and I, Ben Jones of Northwestern University, looked at the educational technology market and asked the following question. Why don't more technologies get used in the classroom? Here in Durham Public Schools, the Performance Learning Center is probably an exception as you look at the rest of the country. Students here are integrated in technology. They're using technology to advance real-world lessons with close supervision from a teacher and instructor. In many other parts of the country, we don't use technology that smartly. And Ben and I wondered why that wasn't the case. One of the reasons that we don't use technology more effectively in the classroom is we don't know what works and what doesn't. There's no FDA, or Food and Drug Administration, for educational apps, for example. So if you download something from the App Store, you really don't know whether it works or not. Sure, you might see a user review or marketing hype, but for a parent like me, and 25% of parents have done this, when you download an app that purports to be educational for your child, you really don't know what works. EduStar, the idea we created, was designed to get at that. What we do is we ask schools, like those in the Durham public school systems, to be test beds for new technology. And that's just not new technologies from big textbook publishers or big companies you might have heard of. It's small startup companies or independent entrepreneurs or teachers themselves who come up with a new app to teach children valuable skills, something like counting to 100 by 10 at a basic level, or even doing more complex physics problems at a more advanced level. Here's the thing. We do clinical trials the way you do in medicine to test a new drug or medical device. But the way we do it is much more quick and much more cheap. We can produce many, many results in a short amount of time and tell you which educational apps work and which don't. How do we know what works and what doesn't? Well, it turns out in the last several years, more than 40 states have adopted the Common Core standards. Those Common Core standards come with assessments where we know what students need to learn by the end of the year. We test these apps against those assessments so we can know that the students are actually learning things that will be valuable for them as they complete the grade. Now, this is an important problem because educational apps are proliferating. Over 100,000 apps on the App Store are educational apps, or at least they say they are. And it's the second largest category in the App Store. So as we get more and more of these educational apps, I hope innovations like EduStar will help us figure out what works and what doesn't. We take the results from those rapid randomized controlled trials and we publish them on a public website available to any teacher, student, or parent. That way you can see if the app you're downloading for a child is a 5-star app or doesn't cut it at all. And teachers can choose which technologies to use in the classroom. The EduStar idea isn't just an idea by academics anymore. A national organization called CFY has decided to take the EduStar idea and make it a reality. So far, they've been successful, raising $7 million in additional funding to make the EduStar platform into something we can actually use every day. We need the consumer reports for educational technology because we can figure out what works and what doesn't. And when we know that, we can put the right technology in good hands, skilled teachers. It's not technology disrupting the classroom. It's smart technology helping teachers do their job better. That's the way we need to think about innovation in education. In healthcare, we also spend great deals of money, but we don't get great results. It's well known and debated over the last several years that we spend more money on healthcare than any other country in the world. Cut the data anyway, look at the statistics, we spend the money in healthcare in every single way imaginable. But for those great deals of spending, we don't get great results. We're not first in life expectancy, we're 51st. We have a high rate of medical errors, we have higher rates of obesity, fewer doctors per person, and fewer people as a percentage with medical insurance than most of our peer countries. How can we spend so much and get so little from our healthcare system? Well, one of the things people are looking at is how to use technology to lower costs in the healthcare system. But unlike education, we have a long history of technology actually being used in healthcare. Think about the life-saving drugs or medical devices, or the imaging equipment that helps you diagnose a disease. The problem is, unlike other areas where technology and innovation have actually lowered costs, we're not really sure that it's worked the same way in healthcare. That's why the next big craze is trying to use technology to lower costs in healthcare. And the question is, what kinds of technology are going to make that happen? Here's why it's an even more difficult puzzle. The spending at the federal and state level on healthcare is going to have to change. 40% of our federal budget is spent on Medicare, Medicaid, and related programs like Social Security. Don't let any politician tell you that you can cut the budget by only dealing with food stamps or veteran affairs or aid to foreign countries. The biggest chunks of our spending are on healthcare. So as much as we have a deficit and debt problem, we also have to think about our healthcare spending problem. And that's why many people across different parts of the political spectrum in business and the nonprofit sector have tried to find ways to bend the cost curve. That means slow the increase in healthcare spending over time. It might be too much to ask for a decrease, but if we could just slow the increase, we could actually bend the cost curve. But here's the thing. When we add new technology, like imaging equipment, we don't always lower costs. That's because some of the incentives in the healthcare system aren't always aligned for cost efficiency. The new generation of mobile apps coming out there that allow doctors and patients to communicate might have the promise to do just that. But again, I don't think we should be replacing doctors with wearable technologies and sensors, just like we shouldn't be replacing great teachers with tablets. There are great doctors out there, those who practice high-quality care at a low cost with a great bedside manner. The issue isn't how to disrupt the healthcare system or change the doctor-patient relationship. It's how to put technological tools into the hands of physicians and, in some cases, patients to make that relationship stronger. Let me tell you about a problem in healthcare and some mobile solutions that I think are very promising. Readmissions. There's a revolving door at the front of many hospitals in the United States of America today. 1 out of every 5 patients under Medicare who goes in the hospital will return within 30 days. That revolving door of readmissions is expensive. Guess who pays for that? You and me do, through our tax dollars. And it seems that it should be easy to reduce readmissions. do the job better the first time, or find a way for patients and doctors to keep in touch, or find a good way to help patients manage the medicines and the interactions between them. It turns out technology, behavioral modification, other issues are very, very difficult in trying to reduce readmissions. So many, many companies are coming into the space and trying to do better at reducing the revolving door in medicine. One of those companies is called WellDoc. They produce a Blue Star application for diabetes. It's not a company I'm affiliated with, but I'm very, very excited about the product and its potential. What the app does is provide people with type 2 diabetes the tools they need to manage their disease. It provides educational information, nutrition information, and even motivation to stay on the right track to keep blood sugar levels at manageable levels. Now, a lot of those best practices are inside a doctor's head somewhere at a great medical center across the country. What apps like this do is put those best practices into a platform that everyone can access. That's the kind of innovation we're going to need. What's more interesting about WellDoc's app and Blue Star is that it's actually survived a clinical trial by the FDA. Think about that for a second. We're used to testing pills and medical devices to see if they have an intended effect. The FDA found in a randomized trial that this app actually lowers blood sugar levels. This app actually works, not with a pill, not with a medical device, but the app in and of itself. That's the kind of innovations we're going to need in healthcare to move the needle and bend the cost curve. The greatest part of the Blue Star app is it allows a real-time data uplink between doctors and patients. That way, the provider knows what blood glucose levels are for the patient, not just every hour, not just every day, but all the time. That kind of information, 2 ways back and forth, helps doctors know which patients need to come back in the hospital and which ones are doing okay. In the long term, that's going to reduce readmissions for type 2 diabetes patients, and that's going to save us money. Applications like Blue Star aren't disrupting innovation in healthcare. They're helping shape a system to get better outcomes. That's how we're going to change the equation in healthcare and bend the cost curve. How do we change the equation in ed and meds? Education and healthcare systems present the biggest challenge for this generation of Americans. If we can't find a way to be a healthy and productive society, we're no longer going to be as prosperous as we once were. And technology does provide some answers, but it's not going to be technology alone that solves the education and healthcare crisis in America. It's going to be technology plus people. We need to think about putting the right technology into the right hands. What does the right technology mean? We need to think harder about evidence, both in healthcare and education. We can't be scared to find out that some of our favorite apps or hardware devices don't actually work the way they're supposed to. For example, take smartboards that we have in almost every classroom in the United States, it seems today. We have no evidence whether smartboards actually work or not. Think about all the mobile apps there that are directed at fitness, diet, and exercise. We don't know whether these apps work or not for medical purposes. Setting up systems to figure out what works and what doesn't, and setting up a dissemination mechanism to make sure that the good apps get spread is how we need to think about it. And the second part is putting it in the right hands. Our doctors and our teachers aren't enemies of disruption. We shouldn't think about trying to work around them or work outside the system. In fact, we should be studying them even more closely and listening to them and trying to figure out what makes great teachers great and what makes great doctors great and what makes other kinds of providers of health and education services do their job better than anyone else. And once we understand that, as technologists, as innovators and entrepreneurs, we can design products that actually help them reach more students or make a greater impact or help their peers do as well as they are. The new equation in eds and meds is going to be taking skilled people plus great technological tools to drive value. That value will come in lower costs, saving money on things like readmissions for diabetes patients. It's going to come from saved time for teachers like my mom who will have to spend less time on paperwork and more time with students. And finally, it'll come from a more productive and skilled workforce that can come up with innovations to move the needle on their own. That's the equation we need to be shooting for in eds and meds, and that's the challenge I hope this generation accepts.